Second down and 10. I got to see that for myself. Meanwhile, getting out of a lot of traffic and picking up the first down is Helaire. So on the second down and 10, he's able to move the sticks, and he's slow and getting up. So the second-year back out of LSU will need some attention.
Yeah.
His backup is Darrell Williams. Injury timeout. Helaire.
Yeah, and you'll see his legs folding underneath him. The thing you always are concerned about after a long delay is somebody getting hurt. That had nothing to do.
Clyde Helaire suffered a knee injury on October 10th against the Bills. During the play, there were about 3 or 4 defenders that were trying to bring him down to the ground. And when they were trying to bring him down to the ground, he was trying to withstand those forces against them. And when that happened, his left leg got caught underneath him. His left knee moved into an internal rotation position, hence providing more forces with his knee moving down towards the ground. And when that leg was moving down towards the ground, it strained and sprained some of the structures that live inside this knee, specifically the MCL. The MCL is a dynamic stabilizer, a knee ligament that lives on the inside of the leg that provides support and stability for forces that are moving inside the knee. There are also your hamstring muscles that come attached to this position here, as well as your medial meniscus that is also attached to the MCL. Now, any one of those structures could have gotten damaged during the play, which would then turn into, we call it grade 1 or even perhaps a grade 2 muscle strain and ligament sprain to that left knee. All reports are showing and stating that he did suffer a grade 1 MCL high grade sprain. What that means is that he just had high dynamic forces placed upon that knee, which caused laxity inside that knee, which was going to take several weeks to recover. I anticipate about 4 to 6 weeks of recovery for a grade 1 MCL knee sprain, specifically requiring many weeks to increase the knee stability, and then also to bring it back to return to sport and return to play. The first 1 to 2 weeks are going to involve reducing pain and inflammation, increasing range of motion, and then restoring normal mechanics within that knee. Weeks 3 to 4 are going to have more of a functional strength, dynamic balance, increasing proprioception, so understanding where his knee is at in space and how to support it and how to dynamically stabilize it with a lot of different forces coming at it. And then you're looking at weeks 5 and 6, now returning to sport-specific drills, returning to participate in practice, looking at practicing multiple days, and then eventually returning to play. We'll be closely monitoring reports to ensure that he is making progress through his rehabilitation process. We'll look at weeks 4 and beyond to see if he has returned to practice in any form or fashion. Closely monitor reports to ensure that he does return to practice, he is making progress through his rehabilitation process, and he's able to return more towards that 5 to 6 week mark.